Black History Month as a Kenyan American woman means to me remembering or honoring and respecting the people who came before me, the African Americans and Black Americans in this country who came before me, who've contributed to American culture, American education, history, civil rights, all of that important historical stuff that's helped make America what it is today. So as a mom of a young 7-year-old daughter, it's important for me to honor and respect the traditions that we've come into, to remind her of the history of Black and African Americans in the United States, and to promote and educate her about continuing with that legacy that we've been given. My dad's a Kenyan who always wanted to be a physician. And I'm the firstborn, and so my whole life I heard about his ambitions to become a physician. Unfortunately, because of his background, he wasn't able to become a physician. However, he did pursue and got a degree in research sciences, and he was actually one of the first Kenyans to come to the United States after independence from the British government was obtained. There was an influx of many Kenyan Americans to come to the United States to pursue higher education because there weren't universities in Kenya at that time. So my dad and hundreds, if not thousands, of other Kenyan men and women came to the United States in the 60s. And the 60s, as you can imagine, were a pretty interesting time for civil rights and Black history in general. So my dad always talked about wanting to be a physician and always talked about coming to the United States. And for me, as a child, I always felt not pressure, but because I respected my dad so much, I wanted to honor his desire to be a physician and especially a surgeon. And so, that's the initial reason why I pursued medicine. Diversity in medicine is important for many reasons. The first one that I can think of is because of disparities in healthcare. So that means, for example, if we look at Black or African American women in the United States, and specifically in my field, OB, GYN, there are significant differences in morbidity and mortality with regards to pregnant women and the outcomes that the neonates have. If you look at things like breast cancer and cervical cancer and so forth, there's issues with access. There's also to healthcare, there's also issues with because of access, when women come in and are diagnosed with these problems, they tend to be more advanced and therefore they have poorer outcomes. So initially, I would say disparities in medicine are important to highlight the problems that African Americans and Black Americans are going through, as well as Native Americans, Hispanics, etc. But then, to carry it further, if I look at myself and how I've been accepted in the Quincy community, I feel that I've been accepted as a foreigner or an outsider in this community, and that I bring my life experience and my life examples as a Kenyan African American woman into the Quincy community, and that exposes people to other cultures. So in that sense, having many different physicians from many different countries, not just Blacks, or African Americans, I think it just helps open everybody's eyes. It helps with inclusivity, it helps people know that there are other folks out there. I talk about my life in Kenya, I talk about my life here, and my patients appreciate that, I feel. It gives them an eye into my world.